99% of nursing students fail this medication safety quiz. Which nursing safety precaution corresponds to this auxiliary prescription label? What is the primary pharmacological rationale for this medication label? What severe adverse effect is associated with ignoring this warning label? Why must a nurse adhere to the instruction on this label before administration? What does this storage label indicate about the medication's properties? Which route of administration is mandated by this label? What is the purpose of the precaution shown on this label? This label is most commonly associated with which nursing concept? What adverse drug reaction is this label warning the patient about? What type of formulation necessitates the instruction on this label? What defines the category of medications bearing this specific warning label? What type of waste must be disposed of in a container bearing this symbol? Which hospital department primarily handles medications bearing this symbol? What specialized nursing precaution is required for drugs with this label? Why is this instruction clinically significant for medications like levothyroxine? How should a nurse educate a patient regarding this medication label? Which action violates the directive on this auxiliary label? What specific complication does this label aim to prevent when attached to sulfa drugs or bisphosphonates? What pharmacokinetic interaction is this label trying to prevent? Why is this warning critical for drugs like prometrium, progesterone? When is a prescriber most likely to mandate this label on a prescription? What type of waste goes into a container with this specific color and label? What does this specific formatting on a drug package insert signify? What is the primary reason for this strict warning on medications like benzathine penicillin G? What is the intended route for a medication bearing this label? Why is this storage label important for certain liquid medications? What nursing action is required when applying this label to a reconstituted medication? What is the therapeutic goal of the instruction on this label? What pharmacokinetic mechanism makes this warning necessary for drugs like statins? is this label a critical warning for pediatric patients with viral illnesses? What does this universal symbol indicate on a substance container? Where is a medication with this label intended to be administered? Where is a medication with this label intended to be administered? What complication is this label designed to prevent when attached to an inhaled corticosteroid? What pharmacological classification is assigned to drugs bearing this warning symbol? What severe organ damage is this label aiming to prevent by alerting the patient to hidden ingredients? What safety precaution must a perioperative nurse take for products bearing this symbol? What hazard does this symbol represent in a healthcare or laboratory setting? Which regulatory standard dictates the safe handling of drugs bearing this label? What is a common rationale for this instruction when applied to loop diuretics? Why are statin medications, HMG-CoA reductase inhibitors, often dispensed with this label? This universal safety label is a primary intervention against which public health issue? What does this symbol indicate about the medication's legal classification? Which class of medications commonly bears this specific controlled substance symbol? What medication safety strategy is demonstrated by the capitalization in this label? Which nursing action is mandated by this specific warning label? What standard pharmacy practice does this label represent for multi-dose vials? Why is this instruction vital for protein-based medications like Apoet and Alpha or certain insulins? What unsafe practice is this label attempting to prevent? What is the rationale for this instruction on specific emergency medications like baby aspirin for suspected myocardial infarction?